Hey guys, so in this video we're going to go through internal rotation manual therapy technique for the hip. So Glenn, how would we do this technique?
So I've got Patrick in supine, just going to clear his hand away. Going to bring him up into flexion, just going to bring the bed up a touch from me. And as long as he's got available range at the knee, I like to come around. And then using my body, I'm gripping close to the hip joint line. Using my body, I'm just going to rotate to my right and bring his hip into internal rotation. That's a really nice technique. Very well supported and very close to the hip joint.
I think it's important with this one as well that you're really focusing on getting an internal rotation. So the femur itself is actually pointing kind of towards the ceiling, and you're going around that, if that makes sense, Glenn. That you're not pulling, again, see some people pulling towards out into almost abduction. We want to make sure that we're getting that true internal rotation and not. And I think when you've got the body there to support that helps that. Basically.
Really helps with that. And I think that initial handhold where you're kind of looping around, as I lock in there, it's a rotation that comes on really easily with that, isn't it? I think if you're grabbing here, it's a little bit more difficult to achieve that.
Yeah, definitely. So your fingers essentially are right round the thigh, almost onto the kind of lateral aspect of the thigh, so that you can then pull round into that internal rotation.
Yeah, I don't know how, it's almost like a monkey grip, isn't it? You'd come around the side here. My torso is in contact with his leg as well. That's really important, as you were saying. And then once we're nice and tight here, it's just a twist of the body.
Yeah.
You can bring in obviously belts and stuff and do a lateral glide at the same time, but we'll go through that in another video.
Yeah, and same thing with the other hip videos. We'll now just do a little quick close up, so you can really see the position that Glenn's holding the hip in, doing this technique.